So always come to the labour ward when you're coming, just to bring whatever clinical notes that you have with you. If you have a birth plan made out, maybe talk to somebody in the antenatal clinic just to make sure that it's relevant, because you can download beautiful birth plans from the internet, but they're not really relevant to the area that you're coming into. So just so like the positions, can you adapt them? Have you access to a shower or a bath when you're within the hospital setting? Okay, and just to make sure that they're happy with your birth plan. Is that all right? But your feet get really cold in labour, so a pair of socks that you're happy to just discard. All right, just that you keep yourself nice and warm. Loads of women decide to go to get the hair done before they come into labour. So if you want to keep the hair when you're in the shower, just bring any kind of a shower hat with you. So you use a lot of energy when you're actually in labour, so it's really important that you eat, okay? So some of the things, and sometimes you don't feel like it, so apple juice or jelly beans, absolutely fantastic. So have them in your pocket that you can eat them away. Is that all right? Provided you're not a diabetic. Other things that they recommend to help labour come on as well would be to eat dates from about 36, 37 weeks onwards. A nappy for the baby, a vest and a baby grow, an aerated blanket for the prevention of cot death or sudden infant death syndrome. And what that means is that there's holes in the blanket that you can actually put your fingers through them. Now you can buy lots of hats and gloves, but to be honest, most of them are too big and they fall off the babies. So if your granny or mother or anyone is good at knitting, they might make a little hat and a set of gloves and socks for the babies. The only other thing then that you might want to take with you when you're coming into the hospital setting is just pads and underwear, all right? So you don't want anything sticking down below. So make sure that these are plain, so they're white and that there's no stickiness on the side. Is that all right? So if your waters were to break at home, which is a sign of labour, it occurs in about 15% of all pregnancies. It's a sign that you're going into labour, but it's not actually a sign that you're in labour. Most women, when their waters are intact, they'll go throughout labour. But some people, their waters go early, but they mightn't get pains for about 12 or 16 hours. So it's one of the reasons that you have to come into the hospital. But if the waters are clear, so it's like turning on a tap and that they're white, then there's no problem with that. So you just ring up and say, my name is Mary whoever, I'm 38 weeks pregnant, my waters are gone and they're clear, I'll be in 2 hours time, and that's absolutely fine. If your waters go and you're not sure whether they're gone, then at home pop on a pad, and then if you're in any doubt that the waters are gone, definitely come in, be checked out just to be sure, and we'll know whether or not. Why it's important to know if the waters are gone or not is that you're at increased risk of infection, or the baby is. So we just need to be sure when your waters went and when they didn't. Is that okay? And the only time when your waters go at home that you have to come in immediately is if there's a green or a black discharge. So it's a sign that the bowels have opened on the baby, that they've passed meconium. So for some babies that's a sign of distress, and for others it might be normal, but I can't tell you over the phone who that baby is. So if there's meconium, green or black, then you have to come into the hospital straight away. Is that okay? If there's blood loss at home, like fresh blood, that's another reason to come straight into the hospital. And the only thing I didn't mention was a mucoid show. Okay, so when your cervix is beginning to shorten, all right, which is one of the things that the body does to allow the labour to progress the way that it should, all right? So if you imagine this is your cervix, so at about 38 weeks, your cervix is long and it's closed, all right? So you've never had a baby before, so that cervix is completely closed, okay? And then remember we said that it opens up to about 3 centimetres and then you're in labour as such. Well, all this, a baby can't come down through a funnel like this, okay? So nature is really good in that it helps and it accommodates the baby. So what actually happens is this actually shrinks from about 38 weeks onwards, and it's full of a mucus plug, so it's a bit sticky. There's fresh blood in it, but it's completely normal. So as this cervix begins to open and it begins to shorten, the mucus plug just comes out, okay? So that's a sign of labour, and it's a very positive sign, and it's normal. Is that okay? So it's only if there's fresh blood and there's meconium that you'd worry that you have to come in straight away.